Coronavirus, what to do and how to protect yourself. Hello and welcome to our YouTube channel. In this short video we will explain coronavirus for you. The outbreak of current coronavirus infection, also known as COVID-19, has been declared as a global health emergency by the World Health Organization. Coronaviruses are common enough to be one of the causes of common cold, but they can cause a range of respiratory symptoms from mild to severe and even death. Since the coronavirus COVID-19 epidemic has killed thousands of people to date and many more are still being affected worldwide, so we should be aware of the coronavirus, of what it is, and all the precautionary measures that one has to take to prevent themselves from getting infected. Here is all the information about the coronavirus in detail so that you can take necessary precautions to help prevent yourselves from getting infected by the deadly coronavirus. What is coronavirus? Coronaviruses are a large family of viruses that are commonly found in animals but rarely found in humans and can cause illness which could be mild to severe. Microscopic studies revealed that their structure is crown-shaped, and that's why it's called corona. Many types of coronaviruses can affect humans, such as NL63, OC43, and 229E, etc. A novel coronavirus, nCoV, is a new strain of this virus that has not been previously identified in humans. Coronaviruses are zoonotic. This is a fancy word to say they are transmitted between animals and humans. They are also reported to be contagious, which means they can be transmitted from contact with an infected person, infected object, or surface. Coronavirus disease 2019, COVID-19, also known as the Wuhan coronavirus, the COVID-19 coronavirus disease 2019 that currently started in the city of Wuhan, is completely unknown and has never been encountered by the scientific community before. It has also been found to be transmitted from animals to humans, mainly snakes, but still not clear from which animal specifically. The majority of the people infected were reported to be regular customers or workers at the Hunan seafood wholesale market in Wuhan. What are the symptoms of coronavirus? Coronaviruses can cause mild to severe symptoms. According to the World Health Organization, mild symptoms can include a runny nose, headache, sore throat, fever, and difficulty in breathing. In severe cases, it can cause pneumonia, bronchitis, kidney failure, SARS, or severe acute respiratory syndrome, and even death. According to current research, the CDC, Center for Disease Control and Prevention, believes that symptoms of COVID-19 may appear in as few as 2 days or as long as 14 days after exposure. There are cases of 0 day and 27 days reported as well. Infants, old-age people, and people with a weak immune system or cardiopulmonary problems are more prone to become infected. How the COVID-19 spreads? All the coronaviruses have almost similar ways of spreading. Current understanding of how the virus that causes COVID-19 spreads is largely based on what is known about similar coronaviruses. The virus that causes COVID-19 seems to be spreading easily and sustainably among people. The virus is thought to spread mainly from person to person. It can transmit from affected people who are in close contact with each other. Another way is via airborne droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It is also thought to be transmitted through contact with an infected surface. It might be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their mouth, nose, or possibly their eyes, but it is not the main way for the virus to be transmitted. Global effects of COVID-19. The COVID-19 epidemic was first reported in China in the city of Wuhan on December 31, 2019. Due to the fact that thousands of people traveling to and from China, the virus has been transmitted to other countries as well. The World Health Organization has declared the outbreak to be a public health emergency of international concern. According to the latest news as of February 28, the viral outbreak has affected 83,733 people globally. There have been 78,832 cases reported in China alone, with 2,778 deaths, mostly in the central province of Hubei. China has prepared quarantine areas in various places separately for isolating people diagnosed with coronavirus. More than 36,383 people affected in China have already been recovered. According to reports from Center of Disease Prevention and Control, 56 other countries have also been affected by the COVID-19, which includes China, Republic of Korea, Italy, Iran, and many others. There is also a case of passengers in Diamond Princess cruise ship, docked in Yokohama. 705 infected and 4 deaths. When we prepared this video on August 28, Coronavirus was reported in 56 countries. Other types of coronavirus. Coronaviruses are a huge group of viruses with different strains that can cause mild to severe illness. Some other severe diseases commonly caused by the coronavirus include SARS, or Severe Acute Respiratory Syndrome, and MERS, or Middle East Respiratory Syndrome, which are both caused by coronaviruses that came from animals. Our research has uncovered that SARS was transmitted from civicats to humans, and MERS from dromedary camels to humans. Symptoms can range from mild to severe. Signs of infection include coughing, fever, sneezing, difficulty breathing, sore throat, and headache. More severe symptoms include organ failure and even death. Research shows that many known coronaviruses are circulating in animals that have not yet infected humans. How can we protect ourselves from COVID-19 infection? To prevent ourselves from getting infected with the coronavirus, we can follow the standard recommendations set by the World Health Organization and the Center for Disease Control and Prevention for Protection, which are as follows. 1. Avoid close contact with infected people. 2. Wash your hands frequently and properly with soap and water or use an alcohol-based hand sanitizer. 3. Avoid touching your eyes, nose and mouth. 4. Cover your mouth with a tissue or elbow while coughing or sneezing, then dispose of the used tissue properly and immediately. 5. Make sure you and the people around you follow good respiratory hygiene. 6. Cook meat and eggs properly and thoroughly. 7. Try to avoid going outside when you are sick unless very necessary. 8. Clean and disinfect frequently touched objects and surfaces in the house using a regular household cleaning spray or wipes. 9. Restrict your contact with pets or other animals if you are sick. 10. The CDC recommends that people who show COVID-19 symptoms to wear a face mask to help in the prevention of the disease from spreading to others. 11. If you feel like having fever, cough, or difficulty in breathing, seek medical attention as soon as possible and refrain from self-medication. When should you call a doctor? If you have traveled to or from countries or any other place having coronavirus emergency and you are experiencing any symptoms like cough, fever, shortness of breath, or headache, etc., then you should try to stay indoors, avoid any contact with people, and call a doctor or visit a healthcare provider immediately, even when the symptoms are mild. According to the Center of Disease Prevention and Control, if you develop a fever and symptoms of respiratory illness such as cough or shortness of breath, within 14 days after travel from China or countries affected with coronavirus, then you should call ahead to a healthcare professional and mention your recent travel and close contact ASAP. Treatment of COVID-19. The bad news is that researchers have still not found any vaccine or treatment to fight against the COVID-19, and good news is, we are close. Since it is a viral disease, antibiotics are of no use, and the antiviral drugs are not effective against the COVID-19. Researchers are developing a vaccine now, and it will be released after tested in clinical trials. Recovery from the disease depends on the strength of the immune system. People who are diagnosed with COVID-19 are advised to receive supportive care to help their relieve symptoms. For more severe cases, treatment should include care to support vital organ functions. People who think that they have been exposed to COVID-19, they should contact their healthcare provider or visit a doctor immediately. There you go. Thanks for watching. Please subscribe for more.